Hi, everybody. Welcome to our weekly training and behavior videos. So, since this is Pet Dental Health Month, um, we are talking all about dental health. And for the next 2 weeks, I'll be showing portions of an interview I did with a board certified veterinary dentist. And this week, we'll be hearing about questions that you have sent in to me about sort of more medical or veterinary aspects of dental health. And then the following week, we'll cover questions about in home care, toothbrushing, dental chews, that kind of thing. So I hope you enjoy. And this is part one of two. Hi, everybody. I'd like to introduce Dr. Brooke Nemec, who is a board certified veterinary dentist and oral surgeon in both North America and Europe. He has 18 practices, I think all in the US. Is that true
So far,
so far?
working on international stuff.
Oh, cool. Um,
Yeah.
anyway, he's kind enough to answer the questions that you sent in to me today, and we are going to get started. Okay, first question is about dental x-rays and how often dogs should have them if their mouth appears fine on the surface.
Okay. Good question. Very common. Dental rating, what we kind of say, and there's no studies that prove this, but what we kind of find in our practice is 25% of oral pathology you're going to find on an awake exam. 25% you're going to find probing under anesthesia and doing a good oral exam. Half of the pathology we find is with x-rays. So I think if you're not taking x-rays, you're going to miss a lot of painful and infectious etiologies. I will tell you that nine times out, no, not nine times, let's say 50% of the time, we find something more significant on x-rays than we were brought in for the first place. Every dog and cat needs their teeth cleaned every year with anesthesia and full mouth x-rays. Now the American Animal Hospital Association and the World Small Animal Veterinary Association both say that all dogs under 10 pounds should have their first dentistry with full mouth x-rays before a year of age.
Okay, so x-ray starting at, depending on your dog's size, between 8 months and a year, and then every year thereafter.
Correct.
We have a question about genetics. What role does
Yeah.
genetics play in a dog's
Yeah.
dental health?
All of it, pretty much. Periodontal disease on the human side and the animal side is well known to be genetic. So when you talk about gum disease, the plaque that is bacteria that forms on the teeth literally overnight, that creates inflammation. That inflammation is known as gingivitis. If the gingivitis is not treated, meaning brushing or having a cleaning or chew treats or whatever, then that will start creating inflammation to the deeper supporting structures. This is where genetics come in. Some animals have really, and people have really good responses to that. They fight off the infection, they keep it as just gingivitis. Other animals and people, like my family, will have a really poor reaction to it and they'll just start reseeding the bone. So the bacteria in the plaque create the inflammation. The body's response to the inflammation determines whether you get bone loss or not. So it's not 100%. I mean, basically, and the way I try to explain it to people is like COVID. Some people got COVID and died. Some people got COVID, didn't even know they got sick. So, but if you never were exposed to COVID, you couldn't have died from COVID. So the number one key is to control plaque. The problem is when you get into certain breeds, i.e., anything under 10 pounds, and then greyhounds and Cavalier King Charles Spaniels, they are much more prone to it because it's a genetic thing. Now, again, there are Labradors that have horrible gum disease, and there are Jack Russell Terriers that have none. So within breeds, there are specific, animals that have it versus not. But in general, small dogs, Cavalier King Charles Spaniels, and greyhounds are going to have really bad gum disease.
I said, I have a very senior dog who can't be safely anesthetized anymore. What can I do
Yeah.
about his breath? Will brushing do anything for him at this stage?
Okay. Well, first of all, what I can tell you is if a dog can walk, it can undergo anesthesia 99% of the time. I hear this. This is one of those things that I hear daily, that literally daily, that frustrates the heck out of me because I don't always, it's not always from clients. I hear it from vets all the time too.
No.
And it is, if there's one thing I could get rid of in my career, well, two things, but this being one of them, There is no such thing as a dog that's too old for anesthesia. There
Hmm.
is no, and I tell people this, age is not a disease. Age is a not natural consequence of not dying. If you don't die, you get older. It does not, now here's a grain of salt. It does not in and of itself increase the risk of anesthesia. But what it does do is increase the risk of having other problems, heart, lung, liver, kidney, which does increase the risk. So we have to work them up. We have to find out. Just because, I mean, my record for anesthesia is 26 years old. I did a 26-year-old cat. I did a 23-year-old dog. So if your dog's over 23, okay, that's doing pretty impressive. But I think unfortunately these clients hear from their vets that are these old-fashioned vets are like, oh, he's too old,
Too
because
risky.
they
Yeah.
lost. Right. It's not. I mean, anesthesia is ridiculously safe. If your dog needs dental care and your regular vet, now again, there are animals, and I will tell you, there are animals, but they are, I mean, less than 1 in 1 million that can't be anesthetized safely. And I tell people all the time, it's a risk benefit ratio. I mean, if your dog's got bad breath, he's got pretty significant infection. Now, if your dog's in heart failure, well, there's a completely different story. But
Uh,
just because your dog's 15 or 18 does not mean they can't have anesthesia. We do them all the time. They do great.
well, okay. Let's say this
So
dog does in fact
it
have
does.
various
Correct.
factors. Should they brush?
Right. Yes, absolutely. Yeah. The more they should brush, they should also add in some kind of antiseptic. Chlorhexidine is probably the number one to use on a brush. It is a very good antiseptic that has no ability for resistance. It tastes bitter, so not all animals will let you do it. But if they can brush, yes, because again, you're not going to get rid of the tartar. I don't care about the tartar. Again, remember, tartar is not the cause of disease. Plaque is, and it's the stuff underneath the gum. And that's why we need to have the chews that get underneath the gum. And that's why brushing is so important, because the bristles get up underneath the gum. So absolutely, anything you can do to decrease the infection.
Are there any behavioral signs they can watch for that their dog has pain in their mouth? No.
No, and that's one of the biggest problems that I deal with as a veterinary dentist is that I see the most horrific pathologies coming in every day. The first words out of all of my clients' mouth is, well, he's got a fill in the blank, broken tooth, broken jaw, abscess tooth, but it doesn't bother him. He's eating. I mean, occasionally you'll see dogs that, will yip from eating or back away from it, but it's like 1 in 1 million.
Which this next question brings my shelter days back to me. We frequently got dogs in with signs of pretty bad flea, like long-standing flea allergy and incisors worn down to the gum.
Yeah.
Does that hurt, or are the teeth just dead now? Um, Basically, are worn teeth a cause of pain?
They can be, yes. As the tooth wears down, if it wears slowly, then the body will band-aid it with something called reparative dentin. It'll kind of like lay down a layer of protective tooth structure. And then as you wear down more, it'll expose that, and that will get usually stained like a dark brown. If it goes, and that's usually fine. That doesn't hurt, it doesn't cause infection, there's nothing to deal with. However, if it goes too fast and it exposes the root canal, now you have and if it's black, usually, if you can see a hole, then that's exposed root canal, and it is painful, and it is an infection, and it does need to be treated
Can
all the
bad
time.
teeth cause other problems in the body?
Absolutely. I've been talking about this for probably 10 to 15 years now, and I was poo-pooed a bit from the dentist at the beginning because there is no direct correlation. There's no study that proves a direct cause and effect, and there probably never will. On the human side, there are thousands, I would say,
Oh,
studies that show a link between dental disease and systemic diseases, and there are mounting evidence in animals. So I will just give you the really quick thing: in dogs, cats, and humans, cardiac disease and kidney disease are strongly related. As a matter of fact, the two highest risk factors for kidney disease in cats are severe dental disease and moderate dental disease. And then
wow.
age, and then over vaccination, then diet. So dental disease and kidney disease in dogs, cats, and humans. In dogs, cats, and humans, also cardiac disease. In dogs and humans, liver disease, and increased inflammatory markers. So C-reactive proteins, all those type of things. And also in dogs and people, Dementia or canine cognitive dysfunction, strongly correlated to bad periodontal health. In humans, diabetes mellitus, arthritis, pregnancy effects, early death. People with bad periodontal disease die earlier than people in good periodontal health. And in two studies, I believe, out of Scandinavia, people with bad periodontal disease died earlier. It was a higher risk factor for early death than smoking. So periodontal disease kills. It does. And oh, by the way, that dementia study in humans and dogs, if you treated the nasty gum disease, the canine cognitive and function dysfunction improved. In people, the Alzheimer's improved. Inflammatory markers go down when dental disease is
Wow.
treated, dogs and humans. In humans, if you have bad periodontal disease and you're like pre-dialysis or on dialysis and you treat the nasty mouth, your kidney function improves, your liver function improves,
Oh
your
my
heart
God.
function improves. Yeah.
So this
So
is
there's a
not
cause and effect there.
necessarily permanent damage. So people could
No,
still make up ground if they can get their dog's mouths treated.
which is why when your dog gets a little bit sick, don't stop treating the teeth. That way, when they get really sick, you don't have to treat them.
All right, so our message this month is learn to brush your dog's teeth if at all possible. And if not, there are other things you can do, like those at home products and also veterinary dental cleanings to help your dog.